Care is a family affair.
We really support families being with their child through every part of our hospital, whether it's ambulatory care or inpatient.
As long as your family is here with you, you feel fine, you feel comfortable.
Quite often when children are left alone, they're afraid because all they see is a strange face.
Especially with blood work, because it can be kind of scary for a lot of kids. So it's just really more comforting to have a family member there.
Sometimes all you need is a hug to know that you're not alone and that you can get through this.
When they see that adult in their life has a trusting relationship with the healthcare provider, it really helps to set up the stage for successful interactions.
They're more settled, feel calmer, and they feel like they're in a safer environment.
They supported me when I was going through like procedures and treatments, and they really comforted me when I was feeling scared and didn't know what was going on.
They really give reassurance to me.
When my brother's in the hospital, I like to come visit him and try to cheer him up. Okay.
My son was on a very strict diet to control his seizures, so when he was admitted, it was important to be a part of that because there's so many doctors coming from different areas of the hospital, nurses, and they maybe didn't understand the diet and understand his needs. So I was able to advocate for him.
They help advocate for my needs, and that makes me feel more comfortable and safer.
Care is a family affair.
We know that parents know their children best.
Families know their children best.
And how to comfort them in mind, body, and spirit.
It's so helpful when a parent is with their child because we feel more connected to the child and we learn what's meaningful for them.
As a medical team here at the Children's Hospital, it's important that the family educate us about their own children so that we know how to best provide the care according to the experts in the home.
It's great to get ideas about what kind of things interest them, maybe what activities, games, movies pique their interest, and we can use that and incorporate it into the speech therapy session.
They know you and what you need and what you want and what you like and what you don't like.
Care is a family affair. We are the historical memory in each appointment, so we're there from the beginning, from the family doctor appointment to the referrals to the pediatricians to the referrals to the surgeon.
Those subtle nuances of how events happened and how my son presents, sometimes they're just not captured by people who know him as well as I do.
I'm the voice of my children.
So when it comes to understanding what he's needing and what he's desiring and things like that and what he values, a lot of times having a nonverbal child comes with understanding a lot of very minute nuances.
When they can't communicate what hurts, or if they're hungry, or if they're tired, they need mom to tell their caregivers what they need.
Care is a family affair.
They don't just treat the child, they help the whole family.
It's not just important to treat the child, but to also treat the parents as well, as they're very much an integral part of the care team.
We try to empower parents by giving them a job during their children's treatments and procedures.
We encourage the family, the parents to come in, to hold their hand and just encourage them throughout the appointment.
We usually get the little ones to sit on mom or dad and they get a nice big snuggle from them.
We encourage family members by positive reinforcement in their child's care and telling them that they do a great job.
We as volunteers try to provide comfort and care to families so that they may feel more at home while they're here.
Here at Rotary Flames House, it's a chance for families to be together and enjoy being a family without having to worry about all the medical parts.
Be able to provide the family a fun activity that they can do together.
If a parent has a meeting with a doctor or a therapist, they could leave the children here and they could actually focus on whatever the meeting is about.
It may be burdensome on families and parents to provide care to their children 24/7. So us as volunteers, we would like to provide that relief for parents and caregivers so that they too can take care of themselves.
Care is a family affair.
Involving families in patient care allows us to design a treatment plan that works best for each individual family's circumstances.
And we're able to address what families' needs are and then be able to give some guidance in terms of what families can do to support their children in the longer term.
Once I leave the doctor's appointment, I often forget what was talked about during the appointment because there's a lot of information coming at me. So it's nice to have someone to kind of bounce off what was talked about and help me make decisions for my health.
We're able to teach them about a care plan and teach them different techniques with puffers and inhalers, and they can help their child follow through on the plan at home.
Care is a family affair.
decisions that are made based on our family's needs and what's going to change requires someone down right when we're making changes and plans. So if we're going to change the way that a waiting room looks or a way that a treatment center looks, having a parent who's actually been in those facilities and use those tools with their child makes a big difference.
Our team uses family feedback to build resources that speak to families, and so when we do that, when we take that extra bit of time and effort to do that, they become very popular.
We hope to encourage families to join our healthcare teams in rounds with the nurses when they're handing over, so that we get the full picture of the child and what's happened most recently for that child. And in that way, the family trusts that we know what's going on.
Sometimes the healthcare team and families don't always have exactly the same objectives, and it's really important that we talk those things through.
Most of the issues that we have with patient care when there's been a deviation of care, one of the things that parents always say is that no one listened to them, and it's a theme that I think we have to end.
Families are a hugely important part of the healthcare team. Like any sort of high functioning team, every member has something important to bring.
So being a part of the team means being literally a part of supporting him in his overall health.
Care is a family affair.
Care is a family affair.
Care is a family affair.